You're watching KREX 5 News.
Welcome back. Well, every day is a holiday if you know where to look, and according to the National Days website, today is National Chronic Disease Day. Paralleling chronic disease is chronic pain, so I brought in an expert to talk about pain. This is Dr. Kevin Johnson, and like most medical professionals, he would normally have a ton of letters next to his name, but he tells me he's also the only certified therapeutic pain specialist on the Western Slope. Dr. Kevin, tell me about pain.
Well, pain is our system's way of protecting us. So it's acute pain is the pain that you're going to experience with an injury. More chronic pains are typically pains that are because the nervous system's gotten stuck on high alert. And so it's just trying to keep you safe. It's confusing when you're hoping for the pain to just go away. And a lot of times that pain that's there, we get fearful of it. And we start to avoid doing things because we think that it's going to cause more harm to us. And that's one of the challenges, is that we think that pain means that there's damage in that area. And that's not often the case, and especially when it comes to chronic pain. People who have chronic disease often will experience chronic pain because their system's trying to protect them, and it's trying to let them know that they're not safe. And when they start to change what they do, or what we do when we experience pain, that system can get stuck on high alert. And
So a lot of times with both chronic pain and disease, when people talk about just pain that won't go away, it seems to happen as you get older. Is that normal? Just it's a part of living? How does that work?
That's actually one of those myths that are out there, that pain gets worse as you get older. There's kind of a bell curve, and it's interesting because pain is the worst in people when they're in their highest stress environments. So typically when people are in their working years and raising families, that's when they develop more chronic pains. And then as those stresses go away, often their system calms down naturally and their pain decreases with that.
Okay, so if you're telling me that we can get rid of this crick in my back that's been there for forever, what kind of advice would you offer?
Well, typically I'd say, first of all, don't fear it. Start working with the system, the pain system, rather than avoiding it. I'd encourage you to be as active as you can be. Do the things that calm it down when it's flared up, but at the same time try not to overdo things as that system calms down.
What are some other myths? If that's one of, it sounds like there's more.
Yeah, there are. That hurt always means that there's harm there. That's a big myth that's out there. The fear is really what's driving the pain. So
there are coping mechanisms that you can learn then to get rid of it?
Sure. Yeah, there's strategies that you can learn to calm down that nervous system.
Well, that sounds nice, and I'm sure that applies to plenty of people. How would people find you if they want to find some of those coping strategies?
Well, they can go on my website, transformativepain.com is a good way to look for that. And really what I'm doing is as a transformative pain specialist, I help bring hope to people who have had chronic pain and help bring them new strategies that they can work with to get that under control.
Excellent. Thank you very much for joining us. It's Chronic Pain Day, but there's also other things going on today, and we're going to keep informing you about more of the news. Thank you for tuning in to Wake Up Western Slope.